station.
Yes, ma'am, I'm ready.
Okay, so if you have read and understood, considering its surgical pathology station, please tell me what is the provisional diagnosis you would consider for this particular patient?
MEN 1 syndrome. Ma'am.
Right away. Okay, what made you think of this condition as the most likely one?
Uh, as patient have history of hyperparathyroidism, and now there is the enhancing lesion at the pancreas.
Yes.
So most probably there is pancreatic carcinoma. Could be gastrinoma, insulinoma, lipoma, or somatostatinoma.
Right. How would you consider MEN 1 or differentiate MEN 1 syndrome from MEN 2 syndrome?
MEN 2 syndrome has the parathyroid hyperplasia along with the medullary thyroid cancer and pheochromocytoma.
All right. Please tell me, right, if you could, all right, if you could yes, if you could define the term hyperplasia.
Hyperplasia is a non-malignant pathology of any tissue which causes proliferation of cells and
Oh, increase.
which
Okay. Oh,
yes,
yeah. All right. Yes. Okay.
and
Which,
enlargement of cell,
okay, which occurs in response to stimuli or without stimuli?
which occurs in response to stimuli.
Very good. Okay. How many parathyroid glands there are, which could be
Uh,
affected in MEN 1 syndrome?
MEN 1 syndrome, all four glands are
Very
affected.
good. Okay, what should be the microscopic picture of a hyperplasic organ?
Yes,
Organ?
there is chief. Yes, there could most of the time there is chief cells hyperplasia
Yes.
involving the parathyroid gland in two different patterns. There could be diffuse pattern and multinodular pattern, and then there could be some focal oxantic cells with the delicate fibrous covering over the nodules, and there could also be some clear cell hyperplasia due
Right.
to the constituent cell water filling.
Okay, these patients, yes, these patients in with hyperparathyroidism, they can sometimes present with stupor, confusion, and hypoglycemia. What might be the underlying cause?
Zollinger-Ellison syndrome or insulinoma.
Yes. These, okay. What might be the other causes of unresponsive hypoglycemia?
There could be diffuse liver disease, insensitivity to insulin, or there could be some tumors like fibrosarcoma, which are secreting insulin-like growth factors.
Yes, or there is ectopic. Yes, yes, same. All right. Could there be any other conditions which can cause hypoglycemia?
Yes, in insulin-like, if there are insulin-like growth factor being secreted from any tumor, non-pancreatic tumor,
Yes.
they cause insulinoma-like symptoms.
Okay. Right. What biochemical test would you ask for in order to confirm your diagnosis?
Uh, to biochemist in biochemistry, we need to check the levels of insulin at the same time as patient has hypoglycemia. There should be increase in insulin to glucose ratio, and also to check for C peptides.
Right. Okay. Can you please tell me, right, considering this patient, what is another pathology that you would suspect to occur?
Patient can have pituitary adenoma.
Right, right, okay. In case of MEN 1's condition, What are the genes which could be found or which are responsible for mutations in insulinoma?
Yes, first one is MEN1. Others are non-functional tumor suppressor genes like P10 um, and TCS2, which cause the activation of the mammalian TOR pathway, and there
Pathway,
could
yes.
also be inactivation tumor suppressor genes of X-linked ATRX and death domain pathway
Okay,
protein.
right. Would you be able to tell me the two hypotheses behind the formation of MEN1?
Yes, in notes it's only written that because the tumor suppressor gene mutations are recessive, uh, uh, and there should be a mutation at the two cell level. That means that there should be genetic mutation and also somatic mutation to be. This is actually the two hit theory for
One is,
the MEN1
yes,
syndrome.
somatic, and the first one is that it is inherited, but it cannot be recessive because it's inherited from one parent.
Yes.
So yes, yeah, okay. Right. You told me, okay, which oncogenes are involved in MEN2 syndrome?
RET oncogene at 10 chromosome.
And the mode of inheritance of MEN2 syndrome is or
Autosomal dominant. All
dominant.
all
Very good.
three are.
Okay, right. If you could tell me, how would you confirm the diagnosis of MEN2 condition?
MEN2 can be, we can do ultrasound, CT scan, or MRI in investigation. And if we have suspicion of pheochromocytoma, we can also go for MIBG scintigraphy
Yes.
and the PET.
Um, if you think of pheochromocytoma, what would you do?
We can also do some plasma tests like
Okay. And what
free
is the urine test that we do?
vinyl mandelic acid. We can check and we can check for fractionated and total metanephrines and catecholamine.
Right. Okay. There is another terminology which is frequently asked in this station, especially. That is, how would you define apoptosis?
It is a programmed cell death.
Programmed cell death. Okay. How would you differentiate apoptosis from necrosis?
Necrosis is basically unprogrammed cell death when there is cell membrane rupture and uh, lysosomal rupture, which causes the mitochondrial degeneration and the nucleus degeneration.
Okay. They say basically apoptosis is considered as physiological process. So, right, if you could tell me which genes protect against apoptosis?
Sorry, ma'am, I don't know that.
Okay, the genes which promote apoptosis, would you be able to give me one example for that?
Yes, there are proto-oncogenes, microsomal RNA genes, and
No, P53 and MYC. And the one which protects against apoptosis, it's BCL2 and interleukin.
okay, thank
Right,
you.
right, good, very good. Okay, in
Thank you,
case
ma'am.
of, yes, in case of MEN2 syndrome, there is another common carcinoma that could occur. Would you be able to tell me the name?
Uh, there is parathyroid hyperplasia, medullary thyroid
Medullary,
carcinoma, and few.
yes. Yes, which is more common. Very good, thank you. Would you be able to tell me this MEN2 is abbreviation of what?
MEN2 is endocrine, multiple and neuroendocrine tumors.
Yes, good. Thank you.
Thank you.